This is Lisa Berry, Assistant Professor here at UConn Health in the Department of Psychiatry and the Center on Aging. The next two vital sessions are devoted to the theme of concussion and traumatic brain injury, or TBI, as an emerging public health issue. Information about concussion and TBI is everywhere. It seems that every time we read the newspaper, watch or listen to the news, or receive social media feeds, we are hit over the head, pun intended, with information about TBI. But how do we make sense of all this information? Is our nation truly experiencing an epidemic of TBI? Is TBI a serious public health problem that deserves government spending? During sessions C9 and C10, we want you to think about what makes a health-related disease or condition an emerging public health issue. Session C9 focuses on defining and evaluating TBI and describing TBI according to person, place, and time. At the end of session C9, you should be able to answer the following questions. If someone experiences a head injury, when is this injury a TBI, a concussion, both, or neither? Who is likely to experience TBI and TBI-related outcomes, such as ED visits, hospitalization, and death? Do TBI rates differ according to principal mechanism of injury? And have TBI rates changed over time? Also, how do I know that tools like the Glasgow Coma Scale are useful in evaluating TBI severity? Session C10 focuses on the sequela and prevention of TBI. At the end of session C10, you should be able to answer the following questions. What is the long-term impact of TBI? Who fares better or worse after experiencing a TBI? Are there social determinants that impact outcomes after TBI? You should also be able to answer, what has been the public health response in terms of TBI prevention? Content experts for these sessions will be Dr. Adam Perrin, Assistant Professor of Family Medicine and the Director of Student Wellness here at UConn Health. Also, we will have Dr. Anthony Alessi, Associate Clinical Professor of Neurology and Orthopedics. Dr. Alessi is also the Director of the UConn Neurosport Program, as well as an Adjunct Professor of Kinesiology through the UConn Musculoskeletal Institute.